We
Thank
didn't
you.
see
That's
our
all right.
Sorry about that.
Thank you, thank you.
So that time, we probably had sound and we didn't have pictures.
Didn't have a picture.
So, okay, well, I certainly would make a motion that we, accept the minutes as published for April 16th, July 1st, and July 23rd.
Second.
All in favor? Any, no questions, no concerns, okay. The other one though, on the 7th,
Yeah.
I don't recall all of that.
That
That was open session, closed session?
it was both.
I'll be honest with you.
Kim was absent, Kathy had to leave
Oh, okay.
after we got started.
Oh, yeah, I saw this because of the Alice Acres
Yeah.
and Arnie correction.
Oh, yeah, that was one of them.
Okay,
Yeah.
Alright.
Little ones, yeah.
Yeah, little,
So the only thing that we need to correct on those is going to be adding the
Pursuant
RSA.
and the time we opened and closed, I mean, the recording should have that.
okay. Any motion on that?
I'll make a motion.
Motion to accept them as corrected?
With corrected.
Okay. All in favor?
Aye.
Okay, well, any other discussion on minutes and the proceedings of the board?
That should put us up to date.
Yeah, I think it does.
Mhm.
All right, well then we will move directly into our treasury report with Tanya Howard.
So I had some questions last month and they were, for the most part, I wasn't able to get the answers to them. Vicky's been busy with payroll and starting to do all the extras. What I do know is that WIC has been backbilled and we are currently up to date on all that as well, correct, Emily?
Yes.
Okay. So I'll still be waiting on the other things that I wanted to look into. But what I did want to discuss this month was that we have several line items that have exceeded the budget. And it appears that there will be a few more before the end of the year. For one, the cell phones, which is 7005, that will be exceeded next month. And the really big one that's going to be exceeded is our salaries and benefits. That will be exceeded probably in 2 months, 3 months at the latest. Some of these extra expenses I know cannot be avoided. Kind of like the insurance, I know insurance has gone up probably 40% this year, so I understand some of these can be avoided, but I think some of them can be avoided and reduced through discussion. And some of them I'm not comfortable with amending the budget at the end of the year. I do think that they should be discussed. So I wanted to make a motion, and I wanted to move that all the budgeted amounts may not be exceeded without prior authorization from the board.
I'll go ahead and second that, just so we can throw it out for discussion here.
What is the cause for exceeding the budget?
Because, well, I
Price
can tell you
increase.
some of the ones do you look at the report at all, or do you just?
I have, but I kind of going off
So
memory. I
one
don't have it
of
with
them
me.
is conference education and training. We're way over on that already. So, you know, that's things that can be discussed before we just continue to accrue them. Some of the line items we did not budget for, and we have expenses on those. That would be the medical services, ELC equipment and supplies, that we don't even have a budget for those. Like I said, the cell phones will go over next month. dues and subscriptions, that one we're over on. I know our election expenses, I'm not worried about that, I know we just miscalculated that.
So I'm wondering, here's what I'm wondering. Because most of those things are actually reimbursed through contracts. Almost everything that we just talked about is partially, if not wholly, reimbursed through contracts. So like all of the, like the conference that I'm getting ready to go to, that's paid for through the MCH contract. It will be reimbursed. All of the QPR training that has been done over time, which was incredibly expensive, but it is all reimbursed through the MCH contract. So I definitely do think we need conversation about this, because I wouldn't understand why we're going over our budgeted amounts if it's all being reimbursed.
Well, I have been watching the numbers every
Uh-huh.
month. I mean,
Right.
I'm comparing, and none of these, if we are getting reimbursed, it's not showing it here.
Okay, so we just need to figure out how to make that match, because
And some of them can't be reimbursed.
I'm sure that there are some that can't be reimbursed.
Right.
But yes, I mean, and it's going to be essentially, it's a month behind, or even almost 2 months behind that reimbursement ends up showing up. But just like on the report that I send to you that has all of the different contracts, I mean, those, I can show you all of the receipts of the things that are reimbursed through that, and a lot of it is that educational portion that you're talking about, even salaries.
So why isn't
That are
that showing
being-
up on here?
I don't know, that's what I'm saying. I'll have to make that make sense to me, because I don't know why it wouldn't show up, but I can, like, I have all of the receipts to show all of those different
Right.
trainings and which one they go to, because that's part of that auditing process for using those contracts in the first place and receiving those reimbursements. I have to show all of that stuff.
Well, I can answer
So-
some of those questions, and that is because the updating of the budget is behind it as far as the contracts go. As you're aware, several positions right now are being paid for out of the infrastructure.
Yes, and I have noticed that.
Okay. And so, but those aren't reflected because the budget hasn't been updated to reflect that. But there are other things that are front-loaded. They
Right.
get paid early in the year, and then after
Well,
the middle of
insurance,
the
for
year,
instance,
they
yeah.
don't get, they don't go up again.
But some of these are monthly because I'm watching them go up.
Mhm.
I'm comparing every month.
Yeah, well,
So,
it sounds like we need to, instead of, in essence, your motion has already been served. It's been approved, some of those things have been approved by
Right.
approving the infrastructure grant, by
Right.
approving these other grants. But we need to reconcile that. And as such, I think that you and Emily need to be sitting down and figuring this out, because if we're missing something, we need to fix it.
Exactly.
Well,
But
we did approve, like the conference,
Correct.
we've approved those things along the way. Why would the cell phone be going up?
I don't know, that's something I
Yeah.
have to look
Cell phones.
into because I don't know who
Yeah,
has cell
who has cell
phones.
phones?
Yeah, so, I mean, those are things I need to look into.
Yeah,
You know, I
you're
just
right.
noticed it.
Do you know who has cell phones?
So
That-
I know that there's a nursing cell phone, and that is, just for various things that they would take it out, they would share it, and that's for like if they're going out in the mobile unit, if they're going out for direct observation therapy, things like that, they would use that cell phone. And then there's an administrator cell phone that I do not use, that
Yeah, for it to go up though, and then I
And it went
would,
up.
probably environmental would have,
Environmental makes sense.
Right, it
They're
does. That
out
was the
all
one
the
that I
time.
was
Right.
So
thinking.
that
Makes
one
sense.
completely makes sense. I'm not sure what else makes sense, but it did go up 2,500 from last month to this month.
See, that's
What?
strange, because it's like, that's set monthly.
That indicates
Yeah.
something in
That's-
bookkeeping that's not accurate.
Yeah.
Or we're being overcharged.
Well, it didn't jump up that much from May to June, but from June to July, it was a 2,500 increase.
That's weird, unless they purchased
Yes.
more. I mean, I can only see it going down because of the cost of
Right.
the phone, but I can never see it going.
Well, I appreciate your attention to detail on this. Right now, it doesn't sound like we have enough data in order to answer those questions.
No,
How
we
do-
don't.
How do we reconcile that?
Look at the bill from the month before and this month and see.
Well, and I do.
What's the difference?
There was nothing. What was different?
Oh, no, I don't have the actual bill.
Oh, okay.
Cause I just went over these numbers. But, yeah, we need to look at how many phones we have, are they, reasonable to be used?
Are those Vax Care, are those phones or are they, okay?
Just like a tablet, just connected to Wi-Fi.
I was just wondering if maybe that would have been a cost.
If I understand correctly, those tablets are not charged to us. The
No.
VaxCare gives them.
Oh,
I was just trying to, think of
But-
reasons.
The
So
tablets- the tablets
now
environmental
maybe,
uses
are they connected to
are
cellular
through
data?
Verizon.
No,
They're not,
Connected.
they're not
Just
connected
Wi-Fi.
to what are they connected to?
just Wi-Fi.
What about this live streaming stuff? Is that connected to the phones?
No,
Mm-mm.
it's wireless
Because
as
to me,
well.
it sounds like possibly cellular data.
Possibly. We just need to look at it and figure it out.
The cell
And
phone
see if
companies,
we
I
can
mean,
keep that to a minimum for the rest of the year. Like I said, I just don't like seeing these numbers go up
Mhm.
and then knowing that we're just not bringing it
Okay.
to everyone's attention, and I just I'm not comfortable with just amending the budget at the end of the year.
Mhm.
I have been given this budget and,
But the only reason that we amend a budget is after we have discussed it and identified funds that are going to cover that or legitimate expenses. And so we have a motion on the table right now regarding approving any expenditure before it goes over budget. I think that is already supposed to be our standard. And so, I personally don't think that we need to pass a new motion. We just need to adhere to our standard of identifying these expenses as they come down the road and making sure we know what pocket or what bucket they're coming out of. So.
and I guess we need to find out why, if we are getting reimbursed, why is it not showing up here?
Yeah, I think that just has to do with something that's gonna be, I don't know, something that has to do with coding, because, honestly, you guys do know of every single expense that has went out of this building. And so the fact that those are going up when I would have expected that they would actually be going down, yeah, we just need to figure that part of it out, because it's a very significant portion of your salaries.
Right.
And all of those expenses, yeah.
I do know that previously it balanced out after we got all of that in. It, remember, was near the October-ish,
Mhm.
when all of a sudden everything kind of came together, but it's probably, like you said, in the coding.
It'd be
Yeah, it
usually,
It has to be in the
coding.
coding, if we're getting reimbursed for it,
Mhm.
it has to be.
well, is there any more discussion on the motion before we?
Who has the cell phone bills?
I can pull it for you when we leave the.
Okay, that'd be best, just look at them. and
Yeah,
see.
we need to look at it, like I said. we
Because
need to
parts
see.
of that is actually also, I don't know if it has the cell phones on it, but parts of the phone bills and things like that are also reimbursed. So,
Well, we are on track to be 10 lines over budget by the end of the year.
10 item, or
10 item, yeah.
line items?
Yes.
And can quantify about how much you're talking about, how many dollars?
Well, our salaries and benefits, quite a bit, especially if we hire, I mean, that's not including our new hires for environmental, it's not including, administrator, raises, any of that. So,
We need to look at that
Yeah.
a lot closer, because that just doesn't make sense. We have had vacant positions
mhm.
that have not been draining the budget.
mhm,
So,
yeah,
well, the motion is on the table still.
Well, are you saying it's a moot point, that the motion is already in existence?
That's what yes. It says it very clearly in our bylaws.
Okay, well, with that said, I think we need to just let it die.
But we already have a
Well,
motion and a
true.
second.
Well, no.
Okay, so if there's no further discussion, let's, how would we vote?
All in favor, all opposed?
All in favor? 1, 2? All opposed? To the
I think-
motion.
To the motion, I think that we've already got it
Right,
done, so.
okay, so it's 2-2, and I will oppose it. So let's clarify what the problem is, and then we can address it more clearly.
Well, and I'm thinking the same thing, Ken. We've got a lot of holes in the staff, and those salaries are not being paid, so.
Yeah.
but I noticed a couple of months ago when I was running the numbers, I knew back then, when we still had people back in environmental, that we were gonna be over. And
you
now
did
that,
mention it.
right, and so,
And we have to give raises, but, yeah.
It needs a magnifying glass.
Yeah.
I think
Let's
it's not,
do it.
I think the problem is it's not getting coded correctly, because,
So,
because we have so many,
well,
big holes.
instead of speculating, we'll go ahead and get the facts.
Of course.
And find out what we're missing.
Right.
And one of the things I think we may be missing is there's an unbudgeted revenue source. It's not reflected in our budget, but it's there.
Mhm.
And we're billing it, but it's not on the paper here
right,
correctly,
it's
so.
not being coded correctly to where it flows over.
Okay, well, yeah, you got your work cut out for you,
Yes,
and
I do.
I would like to be in on that discussion as well, as much as possible. I do have some issues coming up here this whole month, so, I might not be readily available, but keep me in tune.
That's all I wanted to address.
Thank you very much for your attention to detail on that, because we don't want to get to the end of the year and then find that we can't close out our books, so. And we do function on a calendar year, right? I told Tanya that
Yeah.
our
do you know-
fiscal year is a calendar year.
Or
So,
is it October? Do you know?
as far as us specifically, I believe it's a calendar year. I have there's different fiscal years that I deal with the contracts,
Right.
but this particular, like us as a whole as year to
Okay.
year.
Carissa's nodding her
Yes.
head, so I think
It's
we're all,
from, yeah,
the three of us are in conjunction here. Okay, yeah, calendar year, because we settle up with our account, auditor, after that. Okay. No, any more?
Nope,
Thank
that
you
was it.
very much again. All right, here's our exciting part. We're going into our program reports. This month, we're gonna resume the in-person presentations, and I'll let Carissa come up here and sit alongside of me and give us a spiel.
Okay,
Oh, are you gonna
well, I have a
project?
PowerPoint if you
Okay.
want it.
Oh, perfect.
Okay,
Or I
great.
can just-
Well,
Whichever.
then Carissa needs to be able to control her computer. But this is Carissa Roberts. She's our longest tenured nurse here, is that correct? And she's going to, and by the way, these were erroneously placed on the agenda as being August, but they're actually July. Everything is done in arrears.
mhm,
That was my mistake.
Well, this is not the report that Emily sent you guys
I'm
for
sorry.
July.
This is her presentation, it's
Right.
not her board report.
Yeah, we got,
but-
yes,
okay,
we
yeah.
definitely got your published board report. And now you're gonna educate us regarding,
Do you know how to switch it over?
I don't.
Okay.
Let me see. There should be a, like, share screen. Screen
Is it the
display?
screen display?
No.
I don't know how to switch it over
Hmm.
either.
No. Sorry.
It's okay. I put the slides on the sheets.
Okay.
So the first page is just kind of a list of some of the responsibilities here for the nursing department. And you can see the slideshow on the next page. So I kind of went through all the different programs, and you can see Safe Cribs. I did at the first slide. There's a little picture of a family,
Mm-hmm.
of one of our families. So Safe Cribs is a program that we have here where people can get free cribs if they qualify. We do education with these families. Last year I was doing the whole program, but now this year April has taken over. Since there's more babies over on the WIC side, she sees a lot of these clients. We do education when they're in here, and then we do follow-up phone calls. And then we can bill for also those things, and they can get, we can bill for $100 each time with these clients. So I just kind of wrote on there what that program is and what it covers. And then the next slide is childhood lead poisoning prevention program. And with that, we do lead testing here up till 6 years of age. And then we also have case management that we have to do. That I haven't put on the reports. That's one that we are just now picking up since COVID.
The case management you're talking?
If you flip that over, I have the tuberculosis program, which is kind of separate from communicable just because it's run by different people, and then it's usually the second page that Jan does a report of all the clients that we have LTBI and the active TB. So I just kind of listed out some of the things that we do, the DOT, kind of like what that is, where we go out to the client's home. We still have one active person right now. We usually have one or two a year. And then all the LTBIs that we need to get closed are also on that report, that monthly report that I give you guys.
And LTBI is
The latent TB.
latent TB infection.
And we have a program here where they can get medication and stuff if they qualify. And we see those people once a month. And then like if they complete the treatment, they can get a certificate showing that they've done that. And then we also do a lot of TB skin tests, as you guys see on the reports. The next slide is immunizations. We have 3 different funding or sources for immunizations, and I put them on there under funding. So we have VFC, which is vaccines for children, and then we have 317 vaccine, which is the same but for adults. Those are both state funded. And then we have the VaxCare, which is our private insurance. If you have insurance, we can use that, or if you were gonna just pay outright, we have a few contracts. I think Lambert's, the city of, those are somebody.
Ozark, daycares.
Yeah, so then we can just bill them, the company, to pay for those immunizations outright. And then,
And if I recall correctly, at least a few of our business partners get a discounted rate.
yes, if they have a contract. Yeah. And we do that with TB skin tests too, so that's kind of a little bit, I think the OC and some different organizations are taking advantage of that discount. And then the next slide is communicable diseases, which can be an array of things. So I included on the last page, this is the 2024 list of communicable diseases that people have to report to the health department. So that could be anything. I know you guys see the varicella cases all the time. Those are just being tested for immunity. They're not really cases, so I'm not gonna no case. Those take 10 minutes. And then we have pertussis outbreaks, which can take a long time. So everything varies a lot on those. And then
When you say it takes a long time, you're saying it's labor intensive for the nursing department?
it could be, yeah. And you never know, one case is different from the next. So, and some of them are very serious. We had a measles, it was a no case, thankfully, but on the July report, those are very emergent, and we have to do a lot of interviewing. The Legionella cases take a long time. It's about 8 pages to fill out for people, and that's getting a hold of them. Once you get a hold of them, sometimes they're in the hospital, so it takes a lot of time to get those completed and put in. And then the dog bites can also be very quick or very long. So you might have a situation where it's just a neighbor's dog bites you, but we still have to contact the victim, the dog owner, and then usually in 10 days, we're gonna have to revisit all of that. And then if they start the RPEP, like the immunization, all that's gonna have to be entered in, and it can get, you're gonna have to wait for 2 weeks.
And
before you-
RPEP is rabies post-exposure prophylaxis.
Yeah. So I guess it's all animal bites. You'll see this month, we were very busy with immunizations, and then we had a bat bite and 2 more bat exposures, all in the same, like 2 days. So it used to be a lot. So we're sending those off to the state health lab, and then getting those results back, and a lot of communication with the families and education for them.
How long does it take for you to get the report on an infected or a biting bat? How long does it take to get the report?
Well, rabies, they'll send it back really fast. If we get it out on a Monday, I'll have it the next day, the results.
Okay.
Yeah. But then if they come back inconclusive, then we have to treat it like a positive case,
Okay.
and that can be. And then, the next slide is Safe at Home. So we are just application assistants for that program. It's set up through the Secretary of State, but we just help people, victims. We don't do very many of them, but we will help them apply where they can get a PO box set up that's off of the records. It's just a way for them to get an address where they might not, their abuser might not know.
Hi, I'm very sorry to bother you. Whenever you get a sec, I just need to borrow you whenever you get a spare moment in the meeting. Sorry.
Okay, I'm having a problem with our screen here.
Oh,
It says it's on too.
I think it is. I think we were trying to connect to the her PC or.
Right, that we
But
probably could have connected over there.
It's showing a picture on your screen there,
Yeah.
But see, I don't have a cursor. I don't have my mouse. Oh,
Oh, send it for Cassidy.
HDMI cable connect. Here's good. That's what we wanted. Sorry for the technical issues, but I'm not able to.
can you hit enter for that?
I tried that.
Look it up. I have it on my computer at home, how to get your mouse back. Because my mouse
Get a
does
trap.
that every once in a while, and
Get your
I gotta
mouse back.
do this control function something.
It's not responding to anything. No
Turn
response.
it off and turn it back on.
When in doubt, turn it off, turn it back on.
Well, I'm just turning this off here. I can't turn that off.
I think it's the TV. We got to use the remote instead of the
Oh,
keyboard.
oh, I see what you're saying. I forgot about the remote here.
Now, let's talk.
Scratch the mouse's belly and it'll go work. Now, step out.
The light's not on here, so I
Oh,
think
it's
it's
not?
I think it's the battery.
Oh, well, that would,
See, because it's on, but there's no
Oh.
light.
Yeah.
It's the battery. Let me go find your battery.
I'm in. Teresa, well, you can go ahead and continue with your
Okay.
presentation. We'll just
Thanks, sir.
catch up.
And then for the last two slides, I have STD testing. So we do testing here and treatment. And then we usually just the other diseases that are reported from, we have to just forward those on. We don't have to do follow up on STDs. I put the tests that we do. We do syphilis, HIV, gonorrhea, and chlamydia. That's through the state program. So that is through certain criteria that you would have to meet to be able to get testing here for free. So that's an area that I see a lot of need. We get a lot of phone calls. So when we have through the front desk, they're reporting like how many cases that make appointments. We get 3 times, 4 times as many phone calls and screenings and referrals. But there's a lot of places that don't do the testing for what we're seeing in the community.
Oh, yeah. So these are self-referrals? These are people who are,
They just call for testing to see where they can get tested.
so, but they're calling themselves, it's not
Yeah.
the doctor's office?
No,
Referring
it's
them.
just people, and they don't, a lot of them don't have a primary care provider. So they're just looking for any place that they can get treatment,
Mhm.
or they've been in contact with somebody. Trichomonas is like the one that I'm getting a phone call. Greene County was doing testing and they're not now. So I'm kind of out of places to send them for that.
Greene County is not doing testing anymore?
On the trichomonas, they're not.
Oh, okay,
Yeah.
okay.
They're down on a couple of theirs. So we get a lot of phone calls, but they have to screen to see if we can even see them or not through that program. And then for the last one, I just did miscellaneous stuff that we do. There's the Baby and Me Tobacco Free program, which isn't our program, but we can help get people.
Take good notes.
You have the slides. Callie did the slideshow. It's very good. On the tobacco free program, parents can get money vouchers for free diapers and wipes if they just sign up for that program and follow through with it to help them quit smoking. We do general health checks, stuff like blood pressure checks. Some people will come in and want that done. We also do a Hep B case management for pregnant moms, and then once they have their babies, we have to follow through and fill out forms on that. And then we also do the pregnancy test for temp Medicaid, and then Callie can get them signed up for temp Medicaid. And then I didn't put it on the slides, but I just put, I think it's on the front sheet, that we just help with all the contract deliverables. So some nurses might be QPR trained or those kind of things as one of our roles and responsibilities. And that's all I have.
All right.
Thank you so much.
Any questions for, I know I've thrown questions at you as we've gone, but are there any other questions? Well, thank you very much. We appreciate it.
Okay.
Now we'll see if we can get this thing back online. I have it says,
Did that get unplugged back there?
yeah, could it accidentally?
But if I move it myself.
Yeah, it says that none of the three are connected.
I don't see anything disconnected. Everything looks.
Would you just restart the computer back there then?